Hello, dear viewers. Welcome to the Vital Health Pro channel. Today we're going to talk about 10 strange signs of liver damage. Your liver is an organ of critical importance for your survival. However, when it's damaged, it can signal this through unusual symptoms. In this video, we will explore 10 strange signs of liver damage. Recognizing these symptoms can prevent your condition from worsening and provide an opportunity for early intervention. The information about maintaining your liver health and detecting potential problems early is of vital importance. The liver is like the chemical factory of your body. It cleanses toxins, processes nutrients, and produces proteins that are vital for your health. Now let's examine what happens when this critical organ is damaged. Symptom 1. Pale stools. When there is a problem with your liver's production of bile, the color of your stool can lighten. Bile is produced by the liver and gives your stool its brown color. Pale stools can indicate a blockage in the bile ducts, which is a sign of liver damage. Excessive consumption of processed foods and high-fat diets can put pressure on your bile ducts. Regular exercise and a healthy diet can enhance bile flow. Specifically, consuming high-fiber foods and plant-based nutrients is important. Symptom 2. Itchy skin. In individuals with liver damage, itching can occur on the skin due to toxins accumulating in the body. Normally, substances that are filtered by the liver and expelled from the body can accumulate in the skin when liver functions are impaired, leading to itching. The consumption of toxic substances like alcohol and smoking can increase skin itchiness. Keeping your skin moisturized and using mild, natural skincare products can help reduce itching. Additionally, prefer organic foods to decrease exposure to toxins. Symptom 3. Easy bruising or bleeding. The liver is responsible for the production of crucial proteins that aid in blood clotting. When the liver is damaged, the production of these proteins decreases, making the body more prone to bruising and bleeding. The excessive use of blood-thinning medications, such as aspirin, can exacerbate this condition. Consuming foods rich in vitamin K, such as green leafy vegetables, supports the blood clotting process. Symptom 4. Chronic fatigue. Individuals with liver damage often experience unexplained chronic fatigue. This may be due to the liver's inability to effectively filter toxins, leading to a disruption in the body's overall functioning. Excessive consumption of caffeine and sugar can contribute to energy crashes. Adequate sleep, balanced nutrition, and avoiding stress can help increase energy levels. Symptom 5. Swelling in the ankles and legs. Impairment of liver functions can lead to fluid accumulation in the body. This condition often causes swelling in the legs and ankles and is a sign of the liver not functioning properly. Dehydration and excessive alcohol consumption are the main causes of dark-colored urine. Drinking plenty of water and limiting alcohol intake can help maintain the normal color of your urine. Symptom 6. Dark-colored urine. Individuals with liver damage may have dark-colored urine. This condition is associated with the liver's inability to properly process bilirubin, resulting in bilirubin passing into the urine. Prolonged sitting or standing can contribute to swelling in the legs and ankles. Regular movement and adequate fluid intake can prevent fluid accumulation. Reducing salt intake is also important. Symptom 7. Yellowing skin and eyes. Jaundice occurs as a result of the liver's inability to properly process bilirubin. The yellowing of the skin and the whites of the eyes is an indicator of elevated levels of accumulated bilirubin. Excessive alcohol consumption and certain medications can stress the liver and trigger jaundice. A healthy liver diet and regular detoxification can help prevent jaundice. Symptom 8. Nausea and vomiting. Liver damage can negatively affect the digestive system, leading to symptoms such as nausea and vomiting. Disruptions in the production of digestive fluids play a role in the development of these symptoms. Fatty and spicy foods can trigger nausea and vomiting. Eating light and frequent meals can soothe the stomach. Additionally, ginger and peppermint tea can calm the stomach. Symptom 9. Mental confusion. The liver cleanses toxins from the body. In individuals with liver damage, the accumulation of toxins can reach the brain, leading to mental confusion or difficulties with concentration. Alcohol and drug use can exacerbate mental confusion. A healthy diet, adequate sleep, and regular exercise support mental functions. Symptom 10. Pale gums. Improper functioning of the liver can lead to a decreased capacity for oxygen transport in the body. This condition can manifest as symptoms such as pale gums because body tissues do not receive enough oxygen. Poor nutrition and iron deficiency can lead to pale gums. A diet rich in iron and adequate intake of vitamin C support the health of the gums. Thank you for watching our video. For more content, don't forget to subscribe to our Vital Health Pro channel and turn on notifications.